Hi, I'm Dr. Brian Koffman, a retired family doctor, a CLL patient myself, and the co-founder, chief medical officer, and executive vice president of the nonprofit CLL Society. And I'm here today to talk about some of the most important papers from the American Society of Clinical Oncology meeting from 2022. The first paper I'm going to talk about is Racial and Socioeconomic Disparities Among Patients with Chronic Lymphocytic Leukemia, Analysis of Surveillance, Epidemiology, and End Result Program Data. What follows is our patient-friendly summary of this research. And we start with the bottom line. Being American Indian, Alaskan Native, and Black were independent prognostic variables for having a shorter overall survival, in other words, for not living as long, while higher socioeconomic status was found to be a significant independently associated with living longer for CLL patients. Who did this research and where was it presented? Dr. Adam Kittai and his colleagues at Ohio State University Comprehensive Cancer Center in Columbus, Ohio, presented the results at the American Society of Clinical Oncology, or ASCO's annual meeting in Chicago in 2022. What's the background? Therapy for chronic lymphocytic leukemia, or CLL, has drastically improved over the past 2 decades, with novel oral agents, improved immunotherapies, and better testing. However, it's not clear that all have benefited equally from this progress. The team at Ohio State University used the surveillance, epidemiology, and end results, maybe better known to you as SEER, S-E-E-R data, to determine how race and socioeconomic status affects survival for those with CLL. SEER is a free source of information from the National Institutes of Health, specifically the National Cancer Institute, or NCI, and is, quote, an authoritative source for cancer statistics in the United States. Methods and participants. CLL cases reported to the 18 SEERS program registries between 2006 and 2018 were examined. Data was characterized as to the age at diagnosis, the gender, the year of the diagnosis because treatments and survival has improved over the years, the race, and the socioeconomic status. Statistical analysis was done using multivariate Cox regression analysis to determine adjusted odds of survival. This is a way to separate out one factor from another and is a sophisticated and commonly used statistical method. So what were the results? They looked here at 6,605 cases from 2009 and 2018. The median age was 70. 60% were males, not a surprise. And the ethnic breakdown was similar to what you'd expect. Almost 90% were whites, 7.3% were blacks, 2.4% Asian Pacific Islanders, and only 0.3% American Indian or Alaskan Native. After a median follow-up of almost 4 years, the median 3, 5, and 10-year overall survival, or OS, was respectively 80%, 70%, and almost 50%. So 80% or 79.5% of people were alive at 3 years, 69.5% at 5 years, and 48.8% at 10 years. The multivariate analysis told us that Black race was the strongest independent prognostic variable for a worse overall survival, even when you controlled for year of diagnosis, suggesting race was a significant factor in survival in the era of modern therapies. Not surprisingly, higher socioeconomic status was found to be a significant independent prognostic variable for improved survival. In this analysis, race remained an independent variable for worse outcomes after controlling for socioeconomic status. So what are the conclusions and comments? Black race and low socioeconomic status are prognostic of overall survival in CLL being worse. Further research is needed to determine whether this is due to access to the therapy, quality of the care, social determinants of health, or the disease biology itself, or how the medications work in different races. CLL Society is working with Mayo Clinic on a trial to determine why this might be. Is it something about the disease itself in Blacks, or is the answer more environmental or more about treatment choices? We simply don't know at this time. But if you are from an underrepresented minority, please consider helping us by enrolling in our free trial, and we give a link to this on our website, The Genetics of Chronic Lymphocytic Leukemia, Small Lymphocytic Lymphoma, CLL, SLL, and African Americans and other minorities. Here's some other links and resources. We have a link to the actual ASCO paper, which gives you more detailed statistics. The title is ASCO 2022, Racial and Socioeconomic Disparities Among Patients with Chronic Lymphocytic Leukemia, Analysis of Surveillance, Epidemiology, and End Result Program Data. A similar abstract was presented at the same meeting with similarly discouraging findings. Its title was Influence of Racial and Ethnic Identity on Overall Survival in Patients with Chronic Lymphocytic Leukemia. And in it, it concluded that, quote, Black patients have significantly shorter overall survival to white patients, which is sustained when adjusting for the higher prevalence of comorbidities, that's other illnesses, in the Black CLL population. Unfortunately, the survival gap between white and Blacks has not improved since 2004, highlighting the need for targeted research directed at improving survival in Black patients with CLL. End of quote. CLL Society is committed to increasing awareness of these persistent disparities and searching for ways to improve outcomes for all. Thanks for listening. Stay strong. We are all in this together.